What's the truth about heart disease? Registered nurse Travis Nightingale is back to give us some of the answers, because February is Heart Health Month in Canada. Travis, welcome back.
So heart disease is a umbrella, kind of a blanket term for numerous things that happen in the heart. And it's really cardiovascular disease. So you think it also includes your blood vessels and everything. So your heart arrhythmias, heart attack, plaque buildup, stiffening of the arteries, all of those things contribute to our heart health. And it is the number one killer in Canada, globally actually as well. It's the number one killer because of all those umbrella things that fall under it. And the truth really is that it is not an old man disease. So just because you're not 60 or 70 doesn't mean you're not already contributing to cardiovascular disease. And so the key really is being aware of that early on, because chances are when you're in your 30s and 40s, you're doing the damage that you're going to find out in your 50s and 60s. You just don't see it right away. So it takes a while to build those things up and to really see the effects. And that's why I think people, it doesn't have an immediate response. So it's kind of easy to do the wrong thing for a little while. 20 years later, you can't necessarily undo the damage.
It's hard to believe when you think about how we do so many things, and no matter what somebody tells you, whether you smoked, whether you just take chances doing different things with what you eat, or like thrill seeking in the sports that you may play, and the damages to your back or body. It's so funny how we can say at 18 years old, you got to think ahead, drink more water, do this or do that, don't do this, don't do that. And that lasts until all of a sudden, did you used to?
Yeah.
And you start wondering. Let's talk about the misconceptions that so many of us might be under, such as what we just mentioned.
There are a lot, and it's hard to navigate. And as we know, science is always changing and really hard to stay ahead of it. What the biggest misconception probably is that, if you're young, you don't have to worry about it. Like I'm 37. I'm really probably, if I'm being really unhealthy, eating poorly, not exercising appropriately, smoking, constantly stressed, I'd be doing damage to my heart now that I'm going to find out, 10, 15 years later. And cardiovascular disease does affect women as well, only at a later age. So men by the age of 45 to 54 are 4 times as likely to have a heart attack than a woman. But by the time that woman hits menopause, the gap starts closing. And after about 70 years old, men and women are equal risk factor for cardiovascular disease. And
so are we talking in that age? Like when you say that age, that's 45 to... Wow.
Well, 4 times as likely, just because you're a man.
Okay.
Part of it is because of testosterone and stuff that contributes to elevated cholesterol. Certain lifestyle behavior, men are typically, they don't care for themselves as well, especially at that age. And women after menopause, because it's a drop in estrogen, then they start developing the same risk, so that by about 7 years old, the risk is equal for men and women. But the signs don't present the same way for a man or a woman, let's say having a heart attack. So a man is going to get that classic, chest pain, shoulder pain, pain in the jaw, trouble breathing, sweaty, short of breath. That's very common for men. Women can be incredibly subtle. Sometimes it's just fatigue. Sometimes it's just nausea. So they don't always present with the same classic heart attack symptoms. I actually remember one time in the emergency department, I was still quite new, and it was an experienced nurse that caught this, but a lady came in and she just had tooth pain. And that was the thing, like her teeth hurt, her jaw, her teeth. So they actually sent her for a chest x-ray, did an ECG, and found out that she was having a heart attack. But it was very subtle because she doesn't come in looking like she's having a heart attack. So women can fly under the radar very easily. And I think women, and I'm sure most of our female listeners could attest to this, are not taken as seriously when it comes to health concerns. Women in the past have been treated very poorly. If you want to, have an abortion, back in the day, the husband needs to sign off on it. Or if you want to be on birth control, the husband needs to be okay with it. Women very quickly get dismissed for a lot of the symptoms that they have, that, it's your period, or it's hysteria, it's anxiety. And they do get dismissed a lot for and underdiagnosed, because you're right, men take center stage in the diagnostics, and the women, it's still this old culture of, they're complaining or they're whining, and it's not the case. And oftentimes, you're right, these things do get missed because it's subtle and women aren't taken as seriously when it comes to their health.
What are some of the things we should look at or try at least to do, whether our job enables us to, or our circumstance?
Yeah, one thing, a nice marker to hit. You hear a lot of people talk about steps right now, where they say you should take 10,000 steps in a day. A good marker is 150 minutes per week of moderate exercise. It's good for the heart. It helps lose body fat, which helps take strain off of the heart. It lowers blood sugar. You're using up those carbohydrates. You become less sensitive to insulin. So Exercise, incredibly important to be at a healthy weight. Diabetes is bad, smoking's bad, excessive alcohol is bad. All of those things are bad. But when we have this sedentary lifestyle, it's part of the routine to, you got to rush to work. So you're going to eat something quickly and you buy it up from Tim Hortons or whatever. And then it's lunchtime. Oh, you're going to eat something quick. And then you go sit at the desk. We're not taking that time to care for ourselves. And in your 30s and 40s, you're like, oh, that's okay. I put on a bit of weight. I'll lose it next year. 20 years down the road, you're in the same run. You haven't done yourself any favor yet. And it's so hard for us to invest in our bodies and make it a priority, like any other asset, that you need to start doing something about it now and taking care of yourself now, not counting on, I'll do it later. And people can have genetic abnormalities that you're not aware of. I've had 30-year-olds having heart attacks, and it makes no sense. They look fit, they look healthy. You can have, genetic anomalies that you aren't aware of. But it's an insidious little thing that you can have this ticking time bomb inside you and not really know. So no, it is scary. Talking to your doctor is important as you age and trying to negotiate these risk factors. But I'm notoriously a down player. Like if people are panicking, I'm always like, no, we don't need to panic. This is okay. But I will say, every single time, if it's chest pain, I don't take any chances. I will rather overreact with a chest pain than underreact. So if you're concerned, you're having tightness in the chest, you're having difficulty breathing, or people say it feels like an elephant sitting on my chest.
Yes.
That is the one thing that I say, do not hesitate, go to the emergency department, because you do never know.
Thanks for tuning in to Kelly and Company. Follow us on all social media, and don't forget to like and subscribe to the channel for more.